Here today, we have Michael Williams, who is the Legislative Director for Representative Lucy McBath. Her district is located around Atlanta, Georgia. So without further ado, I'll turn it over to Michael to give some opening remarks.
Thank you so much, Amanda. Good morning, everybody. Thank you for being on this morning. And I want to give special thanks to Amanda, who's my good friend and colleague, and she invited me to speak today. Like you said, I'm Michael Williams. I'm the Legislative Director for Congresswoman Lucy McBath, who represents the 6th District of Georgia. The northern Atlanta suburbs is kind of our territory. She is a founding member of the Black Maternal Health Caucus, and maternal health is very near and dear to her heart. She is really staked out. For me, I was the health lead. I'm actually kind of taking a step back now in my role as Legislative Director, and we have a new Health LA that I'm happy to introduce anybody on the call to if they would like to discuss with them further. But I did handle the healthcare portfolio for the past 2 years, last Congress and the beginning of this Congress. And I also have a little bit of expertise in healthcare. I got my MPH at George Washington with Amanda. That was where we met. And look at us now. So, yeah, I mean, it has been an exciting year for the maternal health community. I think everybody, in the advocacy and policy space should really give themselves a little bit of congratulations and a pat on the back. The strides that we've made through the American Rescue Plan were enormous. That was a big ticket piece with the expansion of postpartum care for Medicaid recipients for 12 months. I mean, that was a piece that I know advocates have been working on for years and years and years, and to have that finally passed into law was a really big deal. So I just wanted to kind of pause and give everybody space to kind of like exhale as we, for 1 second though, because we're right back at it. We're stepping right back in to more legislating, and then there's a lot more that needs to be done. And, I'm really hopeful that the expanded coverage we'll start to see in the data in the next 3 to 5 years, the maternal health outcomes improving. I don't need to tell the people on this call, but the United States has been trending in the wrong direction for a long time. We continue to be ranked dead last in maternal mortality among all industrialized developed nations, which is especially astonishing considering the level of wealth we have in this country. Comparative to a lot of the other countries that we're ranked behind. I think we're on par with the Dominican Republic right now, which is a crisis. And that's the way that my boss sees it, the Congresswoman sees it, and that's the way that I see it. We continue to see very large disparities between white and Black and Indigenous women of color. And that's across all socioeconomic scales, right? So even if you control for education, even if you control for income, even if you control for access to care, that disparity continues to persist. And, that's one of the big things that the Black Maternal Health Caucus is out to really tackle. How do we address that massive gap that we see between white women and women of color? But that's not to say that, it's a much better situation for white women. We're still, even if you take out the women of color, we still rank really, really poorly in maternal health outcomes. And we need holistic solutions to try to deal with this issue. And, we continue to see mental health issues associated with pregnancy take too many lives. We continue to see hemorrhaging, too many C-sections that are unnecessary. It's a whole litany of things that we need to address from a policy standpoint. And I know that the Black Maternal Health Caucus and my boss is remaining focused on those things to try to mitigate some of those outcomes that we're seeing. As a founding member of the Maternal Black Health Caucus, my boss was able to work on legislation, the Lauren Underwood, the Underwoods, great staff, love their staff. If you need some expertise, Jack and their staff is kind of handling the Black Maternal Health Caucus, and he knows He's an encyclopedia on this stuff, and he's great. Very, very smart, very, very passionate, very dedicated. And I worked with Jack early on to kind of develop the Social Determinants for Moms Act, which is our piece of the larger Black maternal health momnibus. And that bill really looks to kind of marshal all the resources from the various federal agencies under one task force to try to come up with some real solutions for the maternal health crisis that we see. And it includes, everything from transportation to nutrition, to childcare. It's a pretty wide ranging bill. And I was excited to see that it got a legislative hearing in Energy and Commerce, and it looks like it could move this Congress. And so that's very, very exciting. But, obviously we would like to see the entire Black maternal health momnibus moved. So we're continuing to focus on that, and that's kind of what we view in the Black Maternal Health Caucus as the next step after the expansion of Medicaid, is to kind of look at some implicit bias, look at these different subgroups and how we can address their specific needs. And so that's kind of where we're moving towards in this next kind of half of the year. And luckily there's a fairly large reconciliation in which we could probably stick a couple of things. And so we're working with committee staff to kind of move the process along on that front as well. I want to talk a little bit about data as well, and maternal health. I know that that's the focus of the coalition, and I know that the boss is also, she's been very active on the public health data information front. And there's also grants in the Social Determinants for Moms Act that would deal with some of the data issues that we see with maternal health. I think the situation was only exacerbated during COVID, and we saw big disparities among pregnant women in COVID that we didn't really have a handle on until much further down the line. And that was because CDC didn't have access to good data from hospitals and public health officials who are on the ground in the community. And so the boss introduced, actually before COVID, we introduced the Data Modernization, Public Health Data Modernization Act, which was passed into law at the end of last year. Time is, it seems like that was years ago. That was actually last December, and that was passed into law. And so, we're starting to see some of the money roll out from that, and that bill will give grants to local and state health departments so that they can get their data infrastructure up to speed, and they can start having real-time data sharing with the CDC. And so, I think the boss's idea behind that was to kind of give the CDC some money and then encourage them to work with private partners and to kind of develop some innovative solutions. And I am really interested in kind of using that approach moving forward on some of our other problems as well, including maternal health. And so leveraging some of the power of the private industry, new technologies, and then kind of having the government step in and make sure that they're used in an equitable and fair way, I think is probably our best path forward on a lot of these things. And so, we're working with committee and we're working with the CDC. We actually have a briefing later this week to get an update on where they are and how they're kind of implementing the bills that we passed, to kind of figure out if this kind of model will work for other areas as well, as opposed to just disease reporting and other reporting, if we can expand it out. And I'm really interested to hear anything that you guys have to say about, innovative solutions, things that, maybe we haven't thought of here in Congress that, you guys think would really move the needle on this issue. Our office is totally open to new ideas. We like new ideas. and so I'm really interested to hear. Once again, I want to thank everybody for being on and for taking the time this morning, and happy to take your questions.
Awesome. Thanks so much, Michael. That was a really comprehensive overview. And I know you guys have been super busy the past few months. So how have the last year and a half changed the narrative on Capitol Hill around the urgency and importance of addressing maternal health and health disparities. I know this was a big issue before COVID, and then COVID kind of took the spotlight away there. So how is it kind of recentered since, we've been starting to open up as a country?
Yeah, I think COVID kind of took over everything there for a second, rightfully so. Obviously, that was an emergency and it had to be dealt with, but a lot of things got put on the back burner. But it also opened up a lot of things, and telehealth and other kind of people were trying to figure out solutions to problems because it was a high pressure situation for our kind of our healthcare system and healthcare providers. I think we're kind of moving back into normal order. Prayers that the Delta variant doesn't cause us to kind of tailspin back into where we were earlier this year. That would be devastating economically and across the board for the healthcare system. And so, but we're starting to talk about some of those ideas again. Some of the other topics that we really focus in on, whether it's substance use, maternal health. The statistics did not improve with COVID. Things got worse. And I think people, after we kind of put the system back together, I think people are looking like for solutions to kind of go back and fix a lot of those issues that really were exacerbated by the COVID-19 crisis. And so I think we're starting to reshift our focus, and everybody's kind of trying to stick their thing in with the bigger package. And so the fact that things are moving is helpful, because it's not like committee staff just forgot about those really important issues. They still are aware of them. And so, having vehicles to move it in has been helpful.
Yeah, absolutely. And it's really kind of been a wild year, but it's kind of nice to have all of these opportunities this year to get some other things across the finish line. So I know you mentioned that your boss is sponsoring the Social Determinants for Moms Act within the Momnibus. For those on the call, that's HR 943. Why is this issue in particular, and just maternal health also in general, so important to your boss? And can you tell us a little bit more about the bill?
Yeah, of course. Yeah. So the boss kind of came to Congress. I don't know how many of you know her story, but her son was killed tragically. For playing loud music in Jacksonville. It made a lot of headlines at the time. And so when she came to Congress, she was really focused, obviously, on gun violence prevention. And when I came onto staff, she said, I really want to expand my portfolio a little bit. And what are some of the real issues in Georgia that I can focus on? And I said, well, the thing that we're worst at is probably maternal health. I mean, we have some of the worst outcomes in the country. And so she really she asked for some papers and did some reading, and she was like, I really want to focus on this, and she had a very difficult time having Jordan, and two difficult pregnancies, but she had a lot of support from her employers and from her community. And she recognized that not everyone has that support, and she wanted to create a system where people did. And so that's kind of how she became involved in the issue. And then, she kind of tasked me with, getting some legislation together. And that's kind of how we came to the Social Determinants for Moms Act. I mean, the bill is fairly comprehensive. It expands WIC. It charges basically pretty much every single agency that you could think of that would be tangentially connected to social determinants to come up with solutions. Childcare is like a big piece of it, having drop-in childcare for people with pregnancy. It's a fairly big bill, but we think that it makes some pretty key investments across these federal agencies, and it brings all the coordination under a single task force, so that there's one person who reports back to Congress, so that we have a better sense of how they're doing. And a lot of dealing with the executive branch and the agencies is kind of siloed. And so we wanted to kind of break down those silos. And that is where the kind of coordinating task force comes in with all of the different pieces.
So I know you mentioned earlier when you're going over things that you're really hopeful the Momnibus will move this Congress. Can you provide a little bit of further insights into those conversations with committee? I know we're sneaking up on August here, so there's going to be quite a little bit of a break. But is there any other like word of hearings or markups we should be aware of, and how can we be helpful here?
Yeah, I think, it's all kind of moving through the legislative hearing process right now. We haven't quite gotten to the markup phase of it. I'm pretty, I have chosen to be optimistic this Congress and that things are going to happen and it's going to be good. And for that reason, I think we have a good shot of getting at least a few of these pieces into a larger package. The conversations with committee, they like a lot of the bills. Some of the bills they think need a little bit of technical work, which is fine. And so it's moving its way through regular order, which is obviously a very important step. But the big thing that has me excited and optimistic is the fact that once it moves to regular order, towards the back end of the year, we should have something to put it in to move it, as opposed to a standalone. Because there are some things that our Republican brothers and sisters are objecting to, like even in our bill, they don't like the WIC expansion. There's a few things that they kind of have sticking points on, and so we need something to shove it into so that we don't get a fierce bipartisan pushback.
Yes, we all know kind of how that goes, and everyone
It does,
loves a large. Sorry, go ahead.
Yeah, no, and I was just going to say, like you said, we're already coming up on August, and it is like there's a lot of stuff that has to be done, especially in the months of September and October, basic functioning of government stuff. And so, there's a chance that a lot of the stuff gets pushed further, which gives us more time to kind of work on things and get the policy right.
Which is always appreciative. I know. Yeah. The longer we have, the more we can kind of.
I know. Yeah.
Yeah. So the last question I have for you before we open it up to the audience is, when Vice President Harris was still in Congress as a senator, she was the primary sponsor of the Momnibus in the Senate. Has there any conversations been going on either with your boss and the administration or the Black Maternal Health Caucus and the administration that you can share, or how those kind of priorities have aligned this year, or maybe if there's opportunities in the following years of the administration?
Yeah, the administration has been great about being communicative, I think, more than anything else. I mean, they haven't given us a definitive answer one way or another. Obviously they have a lot on their plate right now. I think that kind of goes without saying. They're pushing multiple different packages through multiple different avenues and, fighting a battle on multiple fronts. And so, we're I think that our tactic right now is to kind of not be the fly in the ointment and kind of step back and let them work a little bit. And then when the time is right, come back around, because it's less controversial, I would say, than a lot of the other stuff that we're going to stick in reconciliation. So that kind of helps. And so, but we've been in contact with them and they're supportive of the kind of larger framework, but they obviously think, we have to have the committees on board and leadership on board, and they want to see us check all the boxes before they come out and pick support of it.
Yeah, absolutely. That makes a lot of sense. And I mean, it's great knowing that Vice President Harris is there and this is on her plate and her top of her mind as well. Thank you so much for your time today, Michael. We really appreciate it. I think this conversation has been really insightful and including everyone in about what's going on in Congress and kind of catching us all up to speed about what to expect after August recess, where you guys can maybe hopefully take a day or two off.
Thank you for joining us today. Again, you'll get some details on what's happening at HIMSS and how you can participate. Meanwhile, we look forward to seeing you in the month of September, and we are getting ready to start revving up for our next virtual Hill briefing. For those of you who attended the first one, it was dynamo. So I'm really looking forward to the next one coming in October. And anyone is more than welcome to help us in getting that orchestrated, identifying maybe you like to hear from your own state representatives. And if you'd like to help us in orchestrating their participation, please jump in, raise your hand, and we look forward to having you to help to collaborate to make this even bigger than the one that we held in the month of March. Thanks, everybody. Have a wonderful rest of the day and a beautiful week. Take care.